Now, before we proceed, yes, you are reading that title correctly. And that title being Vitamin B is an effective cure for many intestinal patients with chronic fatigue. There's a caveat. In a certain group of patients, about half, about say to be accurate, 42%, but about half, they had high levels of Faecalibacterium Prausnitzii or Roseburia hominis. If those bacteria were high, then vitamin B1 had a miraculous effect at reducing the markers of fatigue. So keep that in mind as we proceed. Now, there's going to be some caveats. Well, what if I increase my plant fiber, so on and so forth, which can correlate with higher levels of Faecalibacterium Prausnitzii or Roseburia hominis? That's for another study. And it's a good question, but still needs to be validated. But to proceed forward, a cure for many patients with unexplained fatigue. For some patients, fatigue can be explained by lack of iron, vitamin D, or low thyroid function. These are all conditions that are easy to treat. But a large group of patients with inflammatory bowel disease remains with unexplained fatigue. To quote, "We really want to help them. And although we don't have an explanation," their words, not mine, "we now have a cure for those that have many Faecalibacterium Prausnitzii in their gut," quoting the lead researcher. Quote again, "Therefore, we now recommend high-dose vitamin B1 treatment to all our patients where we don't find any obvious explanation of chronic fatigue. We know that it only works for about half, with high levels of that bacterium, but it's still a good chance in a month's treatment, the length of the study, even though it's a randomized crossover placebo-controlled study, is cheap," he adds. The clear recommendation also comes because the treatment has proven to be completely free of side effects, at least in the outcome of the study. So let's look at a few of the charts which we created to help explain a little more. All right, the responders. Responders, if you look at the top, had high levels of Faecalibacterium Prausnitzii. About half of them did not. Again, the confounding, or I should say the postulation, that could lead to confounding, if incorrect, would be if they increase the plant fiber and so on and so forth, can now rise Faecalibacterium Prausnitzii, and therefore then the B1 works, meaning you have a better outcome overall. Future studies. You have to be cautious about interjecting publisher bias. We want to stick within the parameter of the studies itself. All right, chart number 2. Of the individuals that had high levels of these particular bacteria, there was a 17 out of 17 success rate in reducing the fatigue markers or improving them by at least 3 points. Now the methodology. Now before I proceed as well, here we have it. You see basically the randomized, the double-blind, placebo-controlled crossover, and then they basically, one group took high levels and then they switched and they didn't take any, and the other group did, and so on and so forth. That's the crossover. The dosaging. Now I want you to keep in mind too, the recommended daily allowance is about 1.2 milligram plus or minus a few milligrams depending on certain circumstances. The amount they used here, depending on body weight, was about 600 milligrams all the way up to 1,800 milligrams per day for that 4-week period of time. Then they crossed over. Yet, those with that high levels of Faecalibacterium Prausnitzii had a 17 out of 17 success rate in regard to alleviating those markers of chronic fatigue. That is pretty amazing. Work with your medical professional. Again, it's pretty overall. You get a microflora composition test if possible. You may be one of those 50-50 chance, one of those lucky ones. And if not, it's a good indicator that maybe you want to work on increasing the Faecalibacterium Prausnitzii levels in your system, because real important for butyrate production and the intestinal tract, as well as microflora, bacteria, microbiome composition. Pretty amazing and pretty simple. That's the amount of thiamine they used, and yet still, they said, according to the study here, no obvious side effects. But proceed as follows. All right, the backstory. Thiamine, vitamin B1, is essential for all organisms and acts as a cofactor for several enzymes involved in glycolysis and tricarboxylic acid cycles. Most microorganisms, plants, and fungi synthesize thiamine, while vertebrates cannot produce thiamine. In humans, the diet is the main source of thiamine, most being absorbed in the small intestine. The consequence of thiamine deficiency, or its aberrant transport to the mitochondria, is an energy deficit that may lead to organ failure, mainly in the central nervous system. Interesting. Again, RDA is 1.2 milligrams. Here, obviously, they boosted that quite a bit. Backstory too. The Faecalibacterium Prausnitzii is a bacterium that many studies have identified as having beneficial properties, or at least being frequently found in people with a healthy gut. The researchers were surprised to find that the presence of a single key bacterium determines whether patients with chronic fatigue experience a good effect from the thiamine treatment. Quote though, when they went to go look at the microbiome, they found people that had high levels of FP or Roseburia hominis, they had, with IBD, also had similar situations. So they didn't see necessarily a certain special microbiome profile between those aspects in regard to individuals with IBD. It looked the same as individuals who had healthy guts, but the response rate to thiamine is what changed it. We thought, quote, we're looking for a fatigue microbiome, a composition of gut bacteria that is particularly seen in patients with chronic fatigue. But we didn't find that. We found that the microbiome of fatigue largely resembles the microbiome of those who are not fatigued. Again, except for that one aspect where B1's effectiveness was found to be quite well in individuals with high levels of FP or Roseburia hominis. Now, let's look at the takeaways. These are the areas that not going to have an opportunity to cover or review in the video that we did right now. But however, though, let's look at the full study itself right there if you want to look in the reference on your own. But it is just amazing to have 100% success rate in that subgroup, which is about 42%, so about half, is really worthy now of greater research. But for it to be fixed so easily, the chronic fatigue, just by elevating one nutrient, B1, between the 600 milligrams to 1800 milligrams, depending on body weight and gender, was quite exceptional. And to use the word cure in the study is very, very strong terms. But still just the same, now that's beginning to lead to so many more questions and possible resolutions for those which are challenged with IBD. So increasing Faecalibacterium Prausnitzii, and then doing B1 later on, if you're one of those individuals who are low, will that help alleviate the chronic fatigue? That is for future study to elucidate, because I don't want to add any publisher bias, but it's a darn good question. All right, gratitude to the researchers for this wonderful find. I am humble you watch. Look forward to see what you and I both discover next week. All right, catch you all next time. See ya. Bye.